welcome to the CDO Magazine interview series. I'm Todd Foley, CDO CISO with Lydonia. Today, I have the pleasure of talking with Chris Hutchins, SVP Chief Data and Analytics Officer at LifePoint Health. Chris, good to see you again.
It's a pleasure to see you too, Todd. It's been an interesting few weeks, a lot of activity around CDO Magazine and a lot of great discussions. So I'm really excited to be here to chat with you today.
There's not just the consideration around data privacy or security, but also bias, right? And it's not something that we necessarily mean in a biased, prejudicial way. Like, there's no technology that's intended to provide bad care, but just the perspective of that AI or how it was developed or how it was applied. There are considerations here that are different than what I would call the traditional objective truth of data, but certainly have been the case with any kind of analytics and decision-making based on those analytics in the past. Are you doing anything unique to that, or are you applying kind of the things that have held you in good stead in dealing with analytic bias in the past?
I think we're pretty early on in most of the use cases that we've been using. And it's on purpose, because one of the things that we're not going to fix with AI or any technology is we don't know what we don't know, first of all. And is that thing we don't know important and relevant? We don't know that either. And that's a problem that's not going to go away no matter what we do, right? If you think about when stealth technology became known to the United States population, it was 30 years old when it happened.
Yeah.
When we find out about it. So there's two things that I think about. The nefarious thing, and that's where most people's thinking goes when we're talking about bias. Some of it's just purposefully being ignorant about certain things, right? Or just, you prefer to believe that things are this way and you don't want to dig into it.
Right.
But the pieces that are perhaps more frightening are when there's things that are relative to healthcare that we don't know. And sadly, we're seeing this constant evolution and discovery of new problems and illnesses and all that. And for just a variety of reasons, no doubt, for that probably are largely due to our, quote, improvements in innovation, right? But the things that are going back to what don't we know?
Yeah.
When we were trying to figure out what to do and what this COVID thing was, we knew what the signs and symptoms were based on, a handful of clinicians that were encountering it and starting to communicate that far and wide. But when we started, it looked like a whole bunch of other things. And if we assumed that we had the models nailed back then, we would have been wrong. We would have missed things. And of course, it would have been even more deadly than it turned out to be. But I think that's a risk that we've got to just keep in our minds when we're thinking through where are the possible areas where we could run into a problem. And it's the missing information scenario that to me is the worst, because it's easier to suppress information than be creative enough to create really horrible information, knowing full well it's going to be damaging, right?
Yeah, I think that's a great lesson, right? I think COVID's a good example that if you were just doing, just applying traditional diagnoses and historical analysis to things, you're never going to find those things that you truly haven't seen before, right? And you're going to be slow to respond to them. And I think being able to maintain that judgment and to be able to continue to work with whatever the technology or the diagnostic tool sets are, instead of being dictated to by them, is a critical part of this that I don't think anyone would argue in healthcare.
You did mention imaging, though, and I think that's an important one. I think there's a ton of upside there, and I think that we'll see some adoption, accelerate over the next year or two in particular. But again, there's a real need for caution there. Because if you were looking at chest X-rays, I actually saw a nice presentation from one of the big pharma companies that had some really promising results using the imaging to identify COVID. But again, there was so much that looked like something else that they couldn't get nearly the accuracy rate that they were wanting to get. So it's just one of those things. If we can augment, I think you use that word, and I think that's the right one.
Yeah.
But we really have to make sure that we have the human interaction with the technology, with those capabilities, because there's just so much it's just not cut and dry, right? And the other piece that we have to be keenly aware of when we're using this kind of capability is there is no humanity about it. There's no sensitivity there. There's no understanding of human emotion, human pain. That's not there. So these things are really meaningful. We can use them to augment what a caregiver or a provider has at their disposal at the point of care. And if we kind of stay focused in that kind of a direction, I think we're going to make some really great strides. But if we lose sight of that, I fear that our arrogance could really bite us. And I don't know if you recall back I'm dating myself a little bit, but the first Gulf War, they had these, out of control raging oil fires, and everyone was convinced it's going to be an ecological disaster worldwide. There's all this focus on all the news stories, and then one day it rained. I was like, oh, didn't account for that. Because you're so focused on something and you're trusting that you've cracked the code, and then wait a minute, there's something else.
I think there's always going to be that need to keep the humanity in any kind of clinical care, and I think there's a lot that can be accomplished simply by focusing on that augmentation or assist approach. But there's danger there too, right? We've seen cases where it's almost a check the box instead of truly involving human review. And I think it's just human nature. If you have some technology, some process, AI or otherwise, where it's making a recommendation and then asking someone to click like yes or no or go or don't go, and they have to do that 3,000 times a day, you're not going to be paying that much attention unless it's as long as it's got high results. And there's got to be some way, and I think this is a big part of a lot of the AI application and design, where you can maintain that humanity in the process.
Yeah, and I think like I said, we're moving at a slow pace on purpose here, slow and deliberate. But those are things that we're going to have to build into the technologies so that we have detection capabilities there to start to pick up on the fact that, oh my gosh, this person's in and out in like 5 minutes, and this individual over here is taking an hour.
Yeah.
Why the difference, right? So I mean, it's not that cut and dry. It's not that simple. But we just have to accept that there's a responsibility that we have to our patients and our communities and to our providers to make sure that we're putting mechanisms in place to keep us on top of that, make sure there's visibility, that we're measuring those types of things. And, we don't make human nature the default, because we like things to be quick and easy. I prefer to be able to have somebody put a steak in front of me and go through the process myself if I have a choice sometimes. But this isn't fast food.
But nothing wrong with fast food, though. But I like the thoughtful way that you're approaching it. I think you're really epitomizing the best of what we counsel our clients to strive for, which is move with caution, but move, right? Look for those opportunities to gain advantage, to be able to drive better care, to be able to provide greater impact to the community. Don't be paralyzed by some of the uncertainty. These technologies, while certainly it's very new how some of them are being applied and the scale to which they're being applied, they're not new. And some of the same cautions and considerations that we've applied to technology over the last several decades, especially in healthcare, are
Right.
equally applicable. Just you need to be thoughtful about that with these things. And I certainly laud the way you're doing it and the way you're thinking about it, because I think that's the surest path to being able to gain benefit without misstepping.
Yeah. And we've got a pretty pretty incredible team that I get to work with here, and we've got people that are looking at all of the things that it shouldn't be a burden to the clinical teams to have to look at. One of the things that we've got to figure out is making it really, really easy for a patient to have a level of understanding that enables them to make a decision and consent for
Yeah.
some of the stuff we're talking about. And that's not something that I'm just going to assume that the doc's going to handle that. Uh, but there is a challenge there because there's a trust relationship that a patient has with their provider. So we just got to make it really easy. There got to be some really simple things and tools that we can put in the hands of our clinicians and the support staff that can help with those things. Because they're probably not going to get excited to get a call from some person that has nothing to do with clinical care, and I want to talk to them about AI. I mean,
Right.
that conversation's a dead end. It's not going anywhere. It could actually make it a lot less likely somebody would want to be involved in that. But that's just an example of something that people that, like chief data officers, your IT teams, your project managers, your legal and risk and compliance teams, those are things that we need to worry about. And when I say worry about, we need to take care of them. And let's do our due diligence and figure out how do we say yes to make progress on something that's going to be impactful for a provider and a patient relationship. And, I'll call this out to our legal, our HR team, our risk and compliance teams, info security. All of these folks are really committed to evaluating things in a very robust way, but they move at a really great pace from my perspective, comparatively to what I've seen in other organizations. And that's a good sign of things to come for us, because everyone's really engaging and they see the value, and we're all running in the same direction.
Chris, thank you for joining me today. For those listening, please visit cdomagazine.tech for additional interviews. Have a great day and a great weekend.
Thank you. You too. It's been a pleasure, Todd.
Thanks, Chris.